The Secretary of State for Health and Social Care, Mr. Peter Kyle.
Good morning, Mr. Speaker. Question number 1, please.
Secretary of State for Health and Social Care, Secretary Matt Hancock.
Mr. Speaker, on the 30th of January, we announced that we're going to increase access to PrEP, doubling the number of people who can receive this potentially life-saving HIV prevention drug.
Peter Kyle.
But funding for HIV prevention has become quite complex, with a complex mix of central funding and local authority funding, and cities like Brighton and Hove still have the highest contraction rates outside of London. Will the Secretary of State meet with me and THT to understand how this is impacting us in the front line and what can be done more?
Yes, of course, I'd be delighted to meet with him to discuss this. In the long-term plan, we made clear that we're looking at commissioning arrangements for sexual health services. I'm delighted that the number of new cases of HIV have been falling, and we've been able to declare that by 2030 we want the UK to be have zero AIDS. Now, that is an achievable goal, but a hard one. I'll work with anybody to make it happen.
Dr. Sarah Wollaston.
Does the Secretary of State, though, share the widespread concern about the variation in availability of PrEP treatment, which is surely an unacceptable situation?
There is a variability in availability. Of course, the current model of delivery is a trial, and we've doubled the size of that trial, but it's still a trial that runs until 2021. But I'm very happy to work with her, as well as the honourable gentleman opposite, to try to make sure this is as available as possible.
Slaughter.
Hammersmith is one of the sites which is now closed. When is PrEP going to be made freely available? Here we have a drug which has almost 100% effectiveness, which will save the NHS money through HIV infection protection. When are we actually going to see it available to anybody who needs it?
Well, as I've said, last month we doubled the availability of PrEP, which is an important step in the right direction.
Will Quince.
Thank you, Mr. Speaker. Colchester is one of the sites that is now closed to men who have sex with men who want to access the HIV prevention drug PrEP. When will the government's commitment, made almost 3 weeks ago, to double the number of places on the PrEP trial be implemented across all trial sites?
Well, it is being implemented as we speak, and I'm very happy to talk to him about when it will be rolled out in Colchester.
Thank you, Mr. Speaker. I welcome the government's commitment to end the transmission of HIV in England by 2030. However, HIV reduction wasn't mentioned in either the prevention plan or the long-term plan. So how will the government reach this ambitious goal without a concerted and fully costed strategy?
Well, we do have a concerted and fully costed strategy. Indeed, I've given the commitment of ending new AIDS cases by 2030 with a plan around that. And the long-term plan goes into detail about about new ways of commissioning sexual health services. So this is a very important area. As she says, it's an important part of the prevention agenda, and we're going to make sure we get it right.
Order. Before we proceed further, I hope that colleagues on both sides of the House will want to join me in extending a very warm welcome to Democratic New York State Assemblyman Sean Ryan, who joins us today. Welcome to you, sir. We're delighted to have you. Jeremy Lefroy.
Question number 2, sir.
Thank you very much, Mr. Speaker. We're increasing the NHS budget by £20 billion, or £33 billion in cash terms, over the next 5 years. This major investment will support the NHS to continue to deliver world-class care, and the long-term plan set out a vision for the NHS, ensuring that every penny will be well spent.
Jeremy Lefroy.
I thank the Secretary of State very much. Local accident and emergency departments, such as County Hospital in Stafford, are absolutely vital for the long-term plan of the NHS. What can my right honourable friend do to ensure that funding is there for these departments, because they need an awful lot of block funding and not so much payment by procedure, or payment as you go?
Well, my honourable friend, who is an advocate for Stafford beyond compare, and an advocate for its A&E, which he has personally put so much effort into saving and ensuring is in good shape. He makes the point, rightly, that if you pay simply per person through the door, that doesn't accurately reflect the costs of providing A&E, so we are moving to a much greater proportion of block funding for A&Es, and then a smaller element according to the cost of serving everybody, to make sure that the finances follow the need.
Mr. Speaker, the latest figures show that more than 1 in 5 patients visiting Leighton Hospital, A&E in Crewe, have had to wait for more than 4 hours. Yet instead of support, the Trust has been financially penalised, unable to access capital support to fund improvements to its A&E, whilst at the same time losing out on the performance element of PSF. Can the Minister explain to me how the Government is supporting Leighton Hospital?
Well, we're supporting Leighton Hospital through the delivery of the long-term plan and the extra £20 billion, £33 billion in cash terms, the first £6 billion of which comes on stream in April in 2 months' time. Now, it's true that a record number of people are going to A&E, and we've got to make sure that the record numbers who are being treated within the 4-hour target are, of course, supported, but that we also support hospitals to do yet more.
Lucy Allen.
Mr. Speaker, in Telford we've been waiting 5 years for the chance to ask the Secretary of State to call in for review a highly controversial plan called Future Fit. We now have that chance, and the Secretary of State's been really generous in his time in listening to the concerns of MPs. The local council, however, has still not yet made any submission to the Secretary of State. Can he confirm that without that submission he cannot call in for review this scheme?
Well, she's right, and my honourable friend has made the case very powerfully for the future of Telford Hospital, and I've enjoyed working with her. But it's true that the call-in powers that I have as Secretary of State can only be exercised when a scheme is referred to me by a local council, and should that happen, I will consider it very carefully.
Angela Eagle.
Mr. Speaker, but will the Secretary of State now come clean with the House and admit that the Lansley Act, which fragmented the NHS into tiny pieces, caused huge inefficiencies, and the successive governments of which he is a member have starved the NHS of resources, which have caused a lot of the problems that our constituents face in increased waiting times and increased pressure on staff?
We on this side care about securing the future of the NHS, and that's why we're putting £20 billion extra into it over the next 5 years, £33 billion extra in cash terms. And yes, we'll consider proposals being made for legislative changes, but what we care about is making sure the NHS gets all the support it needs, not just political nonsense.
Thank you, Mr. Speaker. Would my right honourable friend agree with me that one of the vital components to ensure the long-term future of the NHS is community hospitals? And would he meet with me to discuss what can be done to recruit more qualified staff so that beds at Portland's Community Hospital can be reopened?
I'd be very happy to meet with my honourable friend and discuss this, because community hospitals have got a vital role to play in the future of the NHS as more care is delivered closer to home.
Dennis Skinner.
It wasn't insignificant what happened between 1997 and 2010 under a Labour government. They trebled the amount of money going to the National Health Service. It was a system of hypothecation whereby a 1% increase in national insurance went directly to the National Health Service and nobody else fiddled with it. Compete with that.
It's unusual, Mr. Speaker, but I'm delighted to be able to agree with the thrust of the honourable gentleman's question. We both come, as he knows, from Nottinghamshire mining stock, and it's surprising that we don't agree on more. But we agree on the importance of having a properly funded NHS. That's why we've put the largest ever, the longest ever cash injection into the NHS, because we care that it should be fit for the future.
Yes. Christine Jardine.
Thank you, Mr. Speaker. Question number 3, please.
Mr Speaker, poor air quality is the largest environmental risk to public health in the United Kingdom. Long-term exposure to air pollution can cause chronic conditions such as cardiovascular and respiratory diseases, as well as lung cancer, leading to reduced life expectancy. It has a particular impact on children as they grow, and there is evidence that the process of normal lung function growth in children is suppressed by long-term exposure to air pollution.
Christine Jardine.
Thank you very much. In Edinburgh West, we have two of Scotland's most polluted roads in St John's Road and Queensferry Road, according to recent figures. And studies show that if you live within 75 metres of any major road as a child, you have a 29% increased risk of lifetime asthma. Now, given that there are also 2,000 nurseries in this country close to dangerously high levels of polluted roads, what action can the Minister assure us that is being taken, along with your counterparts in Scotland and DEFRA, to tackle this on a UK scale?
The Right Honourable Lady will be aware that we have a clean air strategy, which, as she rightly says, is led by my Right Honourable friend, the Secretary of State for DEFRA. We have a number of measures designed to improve air quality, for example, reducing all pollutants, getting more diesel cars off the road, more petrol cars off the road, and tackling wood-burning fires. But we also need to be much more vigilant also in advising the public of the risks to this, and including, actually, how they use their cars. The time was when I went to school, I used to walk there. Too often we see parents dropping their kids off with idling engines that cause pollution.
Vice Chairman.
Mr Speaker, the Honourable Lady is very good at warm words. Why doesn't she talk to the DEFRA Minister, Secretary of State? Their plans are to tackle the poisonous air that our children are breathing, pregnant women are breathing, by 2040. The fact is, children are being poisoned now. Get on with it. Yeah. Get to about it.
To be frank, it's not very often that I get accused of using warm words, but I'll take that compliment from the gentleman. But you know, I can assure him we are working very closely with DEFRA. But you know, ultimately, we do need to encourage the public to change its behaviour, and we really need to have much more open debates about the consequences of bad air.
Young Bridgen was a bit slow to stand, but now I've seen him. Let's hear the fella. Andrew Bridgen.
Thank you, Mr Speaker. Will the Minister join me in welcoming the work of UK researchers to develop new protocols to manage asthma, such as a pill to reduce the number of asthma attacks by targeting airway muscles, developed in partnership with researchers in Canada?
Well, of course, I will always welcome any research designed to improve the treatment of asthma. And certainly, one of the things that we must do from a public health perspective is do much more in terms of asthma prevention, so that the likelihood of life-threatening attacks do not come to occur.
McKinley.
Question 4, Mr Speaker. Minister Doyle-Price.
Thank you, Mr Speaker. Under the NHS long-term plan, there will be a comprehensive expansion of mental health services, with at least an additional £2.3 billion in real terms by 2023-24. This is building on our ambitious targets for improving community and crisis care, with the extra treatment of 370,000 adults per year and 345,000 children and young people by 2023.
Yes. But I think the Minister is seeking to group this question with that of the Honourable Member for Oak Hill and South Perthshire. Am I right?
My apologies, Mr Speaker. Yes, indeed.
Very good. I wouldn't want the Honourable Gentleman to feel a sense of social exclusion. Craig McKinley.
Thank you, Mr Speaker. One of my constituents, Mark Verrian, is a patient of Kent and Medway Health and Social Care Partnership. He was first admitted on a temporary basis following an unfortunate but mild episode. He has now been institutionalised for 11 years and has been moved over 100 times during that period, often out of area. The Trust itself has 289 out-of-area placements for adult mental health services, an increase of 100 over the past year, and the cost to local health budgets is obvious. Does my honourable friend agree that my constituent and all the other out-of-area patients deserve local health provision to enable them to remain within the Trust area?
I quite agree with my honourable friend, and frankly I'm horrified to hear the account that he's just raised. We have made a priority of getting rid of out-of-area placements because we know that patients will do better if they're amongst their friends and family. Clearly, the account he's just outlined, which has been for the last 11 years, is totally unacceptable, and I will give this case my own personal attention and meet with him to discuss it.
Thank you very much, Mr. Speaker. What UK-wide steps is my honourable friend taking to ensure Scotland is not left behind in mental health provision, especially considering that only two-thirds of young people are being referred within the 18-week timeline against the 90% target?
Well, as my honourable friend is aware, health is a devolved matter, but I'm keen to share best practice with colleagues in Scotland who've faced many of the similar challenges. In England, we will be testing 4-week waiting times for access to NHS support in the community, and we will be absolutely committed to sharing that expertise, as we often do with colleagues in Scotland.
Smith.
Thank you, Mr. Speaker. Minister, in the Government's 10-year plan for the NHS, a growing share of the budget is promised to improve mental health services over the coming years. But the mental health services in Wolverhampton are in desperate state of underfunding now. I'm receiving letters from my constituents telling me how they're having to wait over a year or more to be treated. One woman told me, I personally know people who attempted suicide, and thankfully it didn't happen, but the aftercare on the discharge from the hospital is non-existent. When are they going to see the benefits of this 10-year plan? Because the time of this uplift takes place, some of them won't be too late.
Minister.
Well, as we outlined as part of the 10-year plan, we fully recognise that there needed to be much more investment in terms of community and crisis care, including access directly via the 111 service. By April, we'll be able to put more flesh on the detail of how we will roll that out. But I can assure the Honourable Lady, I am in nowhere complacent about the challenges that we face in terms of making sure that our mental health services are what people should be given to expect.
Paula Sheriff.
Thank you, Mr. Speaker. Last week, The Guardian revealed that hospital admissions for eating disorders have surged in the last year. Meanwhile, the number of children and young people with urgent cases of eating disorders treated within a week has fallen, and those waiting between 1 and 4 weeks has risen. If prevention is better than cure, then why are so many children and adolescents with eating disorders ending up in A&E?
Well, the Honourable Lady is right in the sense that we do have waiting targets for eating disorders, where the most acute care should be seen within a week. We've seen very good progress, and in fact, in most areas, those targets are met. I will look into the cases that she's just highlighted, because where those targets start to be missed, then obviously that's something we need to give attention. But I can assure her that we do recognise the eating disorders, and tackling with early intervention amongst our youngest people must be done, because in terms of prevention is always better than cure.
Mr. Simon Clark.
Mr. Speaker, on Friday night I joined the brilliant A&E team at James Cook University Hospital in Middlesbrough for a night, and it really was an insight into just how lucky we are to have the NHS staff that we do. They are fantastic. On the subject of mental health, one of the key themes that recurred in the night was the problem of drug addiction and the impact this is having on A&E pressures. Can the Minister set out what action he will take in the long-term NHS plan to make sure that we can tackle addiction?
Well, we are aware that substance misuse and addiction clearly does have a massive impact on mental health, and again I will point to the fact we do have objectives in the long-term plan, including joining up more effectively with local authorities with their work in this area. But in terms of tackling addiction and substance misuse, they're very much key to my priorities.
Gregory Campbell.
Thank you, Mr. Speaker. The Minister will be aware of the high prevalence of mental health issues among ex-service personnel, particularly people who served in Northern Ireland and the Middle East. What provision is she making for those who suffer unduly on the mental health front?
Well, I'm grateful to the honourable gentleman for raising this. Obviously, through the military government, we have an absolute duty to do the best possible care to those who've made that commitment to service on our behalf. And I can advise him that through NHS England's commissioning of specialised services, we are determined to make sure that we have the right provision for all our veterans and servicemen. But this is something that I'm in contact with the Ministry of Defence to make sure that we're doing all we can for them.
Vickers.
Number 5, Mr. Speaker.
Minister Caroline Dynage.
Thank you, Mr. Speaker. In December, NHS England announced plans to increase funding for children's palliative care services to as much as £25 million a year over the next 5 years by match funding investment from clinical commissioning groups.
Martin Vickers.
St Andrew's Children's Hospice, based in Grimsby, that serves my constituency in the wider Lincolnshire area, is greatly valued and much treasured by the local community. Could the Minister clarify exactly how the funding will be delivered and how St Andrews can benefit?
Thank you, Mr. Speaker, and I'm grateful for him for mentioning his own local hospice. We all have wonderful stories about the fantastic care delivered by hospices, particularly children's hospices in our local area. So NHS England will match fund CCGs who commit to increase their investment in all children's palliative and end-of-life care services by up to £7 million a year by 2023-24. This is added to the Children's Hospice Grant, which is currently £11 million a year, and therefore could more than double the NHS support to a combined total of £25 million.
But the fact is, Mr. Speaker, even with those significant investments, most children's hospices will still be reliant almost exclusively on fundraising and philanthropic donations. Does the Minister agree with me, though, that for there to be a proper footing for children's hospices, there needs to be a much quicker move towards significant support from the state for these important facilities?
Well, Mr. Speaker, what he talks about is the way that children's hospices have always traditionally been funded, and indeed hospices have already been funded. But I think what we're looking at here is an incredible commitment by NHS England to the value that hospices, and particularly children's hospices, deliver, not only in end-of-life and palliative care, but in respite care breaks, and also in the immensely valuable outreach services that so many of them offer.
Jack Brereton.
Mr. Speaker, will the Minister join me in thanking the hard work of the Donald Louise Children's Hospice in my constituency, who do incredible work, and join me in welcoming the new facility for young adults, which they are hoping to open in the spring?
Mr. Speaker, he's absolutely right to raise this. And when children's hospices expand and include facilities for young adults, it can make such an immeasurable difference in their local area. In my area, we have the Naomi House Children's Hospice, which opened Jack's Place, which has been such a valuable resource. And they should be just incredibly celebrated for all those sort of facilities that they offer.
Shannon.
Mr. Speaker, and I thank the Minister for that. Could the Minister take this opportunity to guarantee that the £11 million Children's Hospice Grant will be protected for children's hospices, and indeed further increased as a result of the long-term plan to reflect the growing demand and complexity of care provided by these lifetime services?
Yes, Mr. Speaker. So I think this is a really strong signal to clinical commissioning groups about how the NHS values the services provided by children's hospices, not just, as I say, end-of-life and palliative care, but also the other respite and outreach services that they provide, which is why giving them access to up to £25 million will make an immeasurable difference.
Nick Smith.
Number 7, please, Mr. Speaker.
Thank you very much, Mr. Speaker. With your permission, I'll group this with number 17. Leaving the EU with a deal remains the government's top priority, but we're preparing for every eventuality. And I'm confident that if everyone does what they need to do, then the supply of medicines will continue unhindered.
Nick Smith.
Thank you, Mr. Speaker. Can the Secretary of State say how much has already been spent after activating NHS no-deal contingency plans, and what the overall bill for this will be?
Yes, around £11 million has been spent already. We aren't, the NHS is not generally buying the extra medicines that are going into the elongated stockpiles, but the pharmaceutical industry is, because of course we'll eventually buy most of those medicines for the NHS. So there have been costs in the pharmaceutical industry as well, but the cost so far to the taxpayer is £11 million, and I expect it'll remain at around that level, if a little higher.
Vicky Ford.
Thank you, Mr. Speaker. Some of my constituents with diabetes have contacted me regarding supplies of insulin. Could the Secretary of State give us an insulin-specific answer, possibly?
Yes, whilst across all medicines we have requested the pharmaceutical industry have an extra 6 weeks of supplies in case of a no-deal Brexit. In the case of insulin, the two major providers have already made stockpiles of at least double this, which shows that those with concerns about access to insulin can know that the plans we've got in place for insulin are being enacted even more strongly than elsewhere.
Thank you very much, Mr. Speaker. But the Secretary of State is refusing to provide any reassurance to constituents up and down the country, and particularly my constituents. I got an email yesterday from a constituent who said, and I no shame in quoting this, "I have type 1 diabetes, as does the Prime Minister, and the supplies of insulin needles and blood testing equipment all come from the European Union. Insulin is perishable. Without it, so am I." So can the Secretary of State come to the dispatch box and say to my constituents, whichever disease they have and whichever medical supplies they require, they will get them, even if we leave the European Union with no deal? And wouldn't it be the best thing to do, just to rule no deal out?
Well, I've already given the assurances that if everybody does what they need to do, then I'm confident that supplies will be unhindered. And in the case of insulin, that the stockpiles are already double that which we requested. But on the later point about the deal, he's got a really important point about ruling out no deal and that being the best thing for people's supply of medicines. And as he knows as well as I do, if you want to rule out a deal, you need to vote for a deal. So he and everybody in this House should vote for the deal.
Mr. Speaker, the Serious Shortage Protocol SI would allow pharmacists to dispense alternative drugs when there is short supply, but crucially without consulting the GP. The problem is they can't access patients' records and might dispense a drug which has previously caused serious side effects. Is the Secretary of State really expecting such extensive shortages that phoning a GP will be impractical?
This change is to respond to the shortages that happen from time to time regularly within the NHS. In the supply given that the supply of 12,300 drugs is typical across the NHS, there are always some logistical challenges, and this protocol is to try to ensure that we can respond to those challenges as well as possible. Pharmacists are highly trained in what they do and perfectly able to carry out as proposed.
The problem is the key issue is not consulting the GP. And the medical legal responsibility for any problems normally lies with the prescriber. Yet the General Medical Council were not even consulted on this SI. So does he really think such a significant change should be pushed through with a negative resolution and no scrutiny and debate?
Well, it's getting scrutiny and debate now, and I think that the change that's being proposed is about making sure that we can get people the drugs that they need, and of course the responsibility is on a pharmacist to ensure that is the appropriate drug, and if necessary to ensure that the GP is involved. But it's absolutely right that we make changes to ensure we have the unhindered supply of medicines whenever there's shortages, whether that's to do with Brexit or not.
Mr. Speaker, the Secretary of State spoke with his characteristic self-confidence about supply of insulin, but at the end of last week, Diabetes UK said, and I quote, "Despite reaching out directly to the Department of Health, we still not have seen the concrete detail needed to reassure us. We cannot say with confidence that people will be able to get the insulin and other medical supplies they need in the event of a no-deal Brexit." That's Diabetes UK at the end of last week. Why are they wrong and he is right?
Well, Diabetes UK are not suppliers of insulin. Of course, they play an important role in representing those who have diabetes. And we've given Diabetes UK the reassurances, including, for instance, that the stockpiles we have for insulin are more than twice as long as we proposed and were required. And that's an important assurance.
Jonathan Ashworth. Diabetes UK to give them those reassurances directly. Now, the various no-deal medicine statutory instruments that the House will be debating today and on other occasions, the government's own impact assessment says that on a no-deal scenario, the NHS will pay more for drugs, UK firms will face more red tape, NHS patients will go to the back of the queue when it comes to international innovation. Given the consequences of no deal are so devastating for the NHS, will he, like apparently the Justice Secretary will do, resign from the government if it means blocking no deal?
Mr. Speaker, if the honourable gentleman really cared about stopping no deal, he'd vote for the deal as well. And there's something else that's worth saying about this Shadow Secretary of State. He's a reasonable man. He's a sensible man. I like him. And my politics, Mr. Speaker, are probably closer to his politics than his are to the leader of his party. So why doesn't he have the gumption to join his friends over there in the independent group instead of backing this hard-left proto-communist as a leader of the Labour Party?
Question number 8, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. Everyone who has an acquired brain injury deserves to receive the best care and rehabilitative services possible. To ensure this, the NHS long-term plan included £4.5 billion of new investment to fund primary and community health services over the next 5 years.
I thank the Minister for that answer. The NHS does have a good strategy relating to community-based care. In relation to acquired brain injury, would the Minister advise me and Headway Hertfordshire, a brilliant local organisation, on how we can get more proactively involved with this strategy, attract more funding from local CCGs, and in particular, would she meet with me and the organisation to discuss this further?
Minister.
Thank you, Mr. Speaker. I'm delighted he's mentioned Headway. They are a fantastic organisation who do great work. I've met them regularly in my own constituency, and I'd be more than happy to meet them with him as well. Now, the Partnership Board of Local Integrated Care Systems, which will plan and shape these services, will be including the voice of voluntary services and voluntary sector in their area. So his local Headway branch would be well advised to engage with that group.
Thank you, Mr. Speaker. 1.3 million people are living with traumatic brain injury-related disabilities, and brain injury can also be caused by excessive alcohol consumption, and particularly impacted by young people drinking excessive alcohol. What support will the government be giving to local health services to increase the supply of technologies, particularly using creative industry developments, that can help with rehabilitation for those with brain injuries?
Thank you, Mr. Speaker. Well, there's a few things here. First of all, in response to the sort of local community services, as she's already heard, we're putting an extra £4.5 billion into community and local health services. But also through the National Institute of Health Research, we fund the sort of brain injury research that she discusses, talking about how technology and other innovations can be used to better support these people.
Mary Rimmer.
Number 9, Mr. Speaker.
Thank you, Mr. Speaker. The Social Care Green Paper will bring forward proposals to ensure that all adults, including those living with dementia, receive high-quality care whenever they need it. The Government also remains committed to deliver the Challenge on Dementia 2020, making dementia care in England the best in the world.
Mary Rimmer.
Thank you, Mr. Speaker. Sadly, there are an estimated 3,000 people over 65 living with dementia in my constituency, and it is clear that social care crisis is a dementia crisis. Yet the Alzheimer's Society research shows that dementia care providers often charge a premium rate of over 40% more than the standard rate. Will the Minister look at introducing a new dementia fund as part of the Green Paper process to end the unfairness facing dementia patients and their families?
Thank you, Mr. Speaker. She's absolutely right to raise dementia. It is a massive thing in everybody's constituency, and it affects, I don't think there's hardly a family that isn't affected in some way by it. So we are on track to meet our pledge to invest £300 million in dementia between 2015 and 2020. We continue to fund research for dementia treatments and cures, and by passing the Care Act, we introduced a national threshold that defines the care needs that local authorities must meet, and this eliminates the postcode lottery of eligibility across the UK.
When the Minister of State looks at the proposals in the Green Paper for social care reform, will she consider the German system of compulsory social care insurance? It has only increased by 0.94% since introduction in 1994, whilst also delivering care for dementia and other impacts that had not been assessed back in 1994.
Mr Speaker, my honourable friend tempts me to do some big reveals about what the contents of the Green Paper will be, but I will say that it will look at a number of different funding options.
Lloyd. Thank you, Mr Speaker. Dementia in the community, many people with low onset dementia or mid-onset dementia with the right social care, they can stay in their home. The crucial part of it is to have the absolute funding that is necessary to allow people to get the social care support. Within the Green Paper, will the Minister be committing specific sums that will go to social care to keep people with dementia in their homes?
Mr Speaker, the Adult Social Care Green Paper will look at the long-term sustainability of funding of the adult social care system. In the meantime, the Government's investing in giving councils access to up to £10 billion over this current 3-year period to help address some of the shortfalls in adult social care funding, but also to ensure that people have the right services in their local areas as well.
Dementia patients is to have joined up NHS and social care provision. Will my honourable friend work with the Secretary of State for Health to take advantage of local government reorganisation in Northamptonshire to develop a combined NHS and adult social care pilot?
Mr Speaker, my honourable friend is absolutely right to raise this. Integrated health and care systems are very much the way forward if we are to deliver the future of adult social care that we all want to see. And actually, the fact that the long-term plan for the NHS was developed in tandem with the Adult Social Care Green Paper has already shown some of the innovations that we think will make a massive difference, such as the rollout of enhanced health in care homes model.
Minister.
Me again, Mr Speaker. The Green Paper on adult social care remains a priority for this government. We will shortly be publishing this document, which sets out proposals to reform the adult social care system.
Watling.
Yes, I thank my right honourable friend for her answer. This issue was raised recently with me by Councillor John Spence of Essex County Council, and I'm concerned that 2 years later we're still waiting for the publication of this Green Paper. Of course we must get it right, but people need change to the social care system and they need it now. What further steps can you take to speed up this process? Thank you.
Thank you, Mr Speaker. I understand that my honourable friend, the Secretary of State, has actually met the gentleman he refers to. I understand his frustration and indeed I share it. We do need to ensure that the social care system is sustainable in the long term, and we have taken some time to get these big decisions right, but I can assure him that the Green Paper will be published at the earliest opportunity.
The lady, the member for Blackburn, could very legitimately shoehorn her inquiry on question 18, which might not be reached, into this question, which has been. But it's not obligatory. But don't be shy. Get in there. Kate Holland.
Number 18, Mr Speaker.
No. What I mean is she can give us the benefit of her thoughts now.
Well, in the queue. Perhaps the Minister can respond to our feelings on government cuts in local government, particularly the impact on social care. Because what this government's created is a postcode lottery on the quality of care the residents, particularly in Blackburn, face. The Secretary of State spoke about political nonsense to my honourable friend from Wallasey. What is a political nonsense is that Blackburn has faced a 60% funding cut from this government, where Windsor and Maidenhead has only got a 19% cut. This government is creating a postcode lottery for adult social care in particular, and it's not acceptable. What is the Minister going to do to address the inequalities in areas?
Nobody can accuse the honourable lady of failing to take full advantage of my generosity. Minister!
Thank you, Mr Speaker. I don't agree with her. I think that actually what this government has done is tried to tackle the geographical inequalities in care across the country. We've increased funding, we've increased access to councils by up to £10 million. That's a 9% real terms increase in funding. But in addition to that, we established a national threshold that defines the care needs that local authorities must meet under the Care Act. And this has really started the work of eliminating that postcode lottery, the eligibility lottery across England.
Chris Leslie.
It's 2 years since the government promised this social care green paper. And in that space of time, we've had lots of words from the government, but we've had a lot of neglect from the government on this particular issue. Doesn't this delay, this prevarication, putting long-term issues to the back burner, typify what is wrong with the broken politics in this country?
Well, Mr. Speaker, first of all, can I welcome him to his new location in the chamber, and maybe from that location he might recognise that actually there has been a failure of successive governments to get to grip with this very thorny issue of the long-term funding of adult social care. We are the government who has decided to tackle this. We will no longer put it in the too difficult pile, and we'll be publishing this document shortly.
Barbara Keeley.
Well, Mr. Speaker, but the government is not tackling it, is it? Absolutely. Age UK has found that 50,000 people who had applied for social care have died waiting in vain for that care in the 700 days since the government first announced its Green Paper. How many more people will have to die waiting in vain for social care before the government fixes the crisis it has created?
Mr. Speaker, I can't stress enough how much money. The fact that the government has given councils access to almost £10 billion to address this issue. It's an increase of 9%. Local authorities have a statutory duty to look after the vulnerable, the elderly and the disabled people in their area, and we have given them access to the funding to do it.
Newlands.
Number 11, Mr. Speaker.
Thank you, Mr. Speaker. The long-term plan explicitly recognises the importance of the workforce. So my right honourable friend has commissioned the Chair of NHS Improvement, working closely with the Chair of Health Education England, to lead detailed work programmes to deliver an implementation plan. Social care also plays a vital role, and the forthcoming Adult Social Care Green Paper will set out our plans to recruit, train and retain good people.
Thank you, Mr. Speaker. The Minister's right. Workforce is a challenge for all 4 health services in the UK, but in England there's been a drop of 900 students taking nursing degree courses in the last 2 years, and at over 11%, NHS England has more than twice the nursing vacancy rates of Scotland. And with a 90% drop in EU nurses coming to the UK due to Brexit and fewer students starting degree courses because of cost, is it not time to follow Scotland and by reintroducing the nursing bursary and ending tuition fees?
Well, I'm sure the honourable gentleman will want to recognise the latest UCAS data for this year's application cycle, which shows that compared to the same time as last year, there's actually a 4.5% increase in applicants for undergrad nursing and midwifery courses. This is a significant improvement. He will also want to recognise, of course, that the loan system provides an extra £1,000.
Order! Mr. Graham, calm yourself. You have aspirations to statesmanship, and I wish to cultivate and hone that legitimate aspiration. Calm, zen, statesmanship. Derek Thomas.
Mr. Speaker, on Friday I was really privileged to take part in the launch of the Health and Social Care Academy in Cornwall, where the Cornwall NHS providers and social care have got together to decide to train local people of student age but also older mature students to train within the local health and social care provision without student tuition fees and to secure a job in Cornwall. Can I welcome the Minister to come and see what work we're doing and welcome this local innovation that helps to address the workforce challenge in the NHS?
Well, what my honourable friend rightly points out is that there are a number of routes into a number of the healthcare professions, and I'm delighted to see what's going on in Cornwall, and I understand that my right honourable friend will be coming to visit him in the very near future.
Matters.
First ever NHS workforce crisis with over 100,000 vacancies. The situation is unsustainable, and well-respected think tanks say that the figure could rise to 350,000 vacancies within a decade. So what does the Minister consider to be a sustainable vacancy level both now and in a decade's time?
Well, the honourable gentleman will recognise that the money being put into the NHS by the long-term plan, the £20.5 billion in real terms, will make a significant difference. He'll also want to recognise the rollout of medical places, the fact that more people are applying now than they were last year for nursing places. This is, and the detailed implementation plans that my right honourable friend has commissioned. These will deliver a sustainable workforce.
12, Mr. Speaker.
Mr. Speaker, NHS England announced in the NHS long-term plan that it will work with partners to improve community first response and build defibrillator networks to improve survival from out-of-hospital cardiac arrest. A national network of community first responders and defibrillators will help save up to 4,000 lives each year by 2028. This will be supported by educating the general public, including young people of school age, about how to recognise and respond to out-of-hospital cardiac arrest.
I thank the Minister for a response. 12 young people a week currently die from a sudden cardiac arrest. 80% could potentially be saved if they had access to a defibrillator. Will the Minister look at supporting the installation of defibrillators in all schools in England and Wales?
Well, my honourable friend is right to highlight that the 12 deaths which happened from sudden cardiac arrest in the young. And whilst the purchasing of a defibrillator is a matter for individual schools, the government does wish to encourage schools to buy defibrillators. The NHS supply chain is engaging with the school networks to get good prices for these defibrillators, and the DfE has published guidance on the government website for schools on buying and installing an AED. In addition, in January, DfE announced plans for all children to be taught basic first aid in schools, and that will include how to do CPR and use a defibrillator.
Number 13, Mr. Speaker.
Mr. Speaker, national waiting time standards for early intervention in psychosis, improving access to psychological therapies and children and young people eating disorder services are already being met or are on track to be met by 2020-21 for the North West. Under the NHS long-term plan, we will introduce new waiting times and targets, and we have an ambition to deliver much more treatments for all those who need it.
Thank you, Mr. Speaker. Adult waiting times on the Wirral for talking therapies for anxiety and depression, Mr. Speaker, are some of the worst in the country. The average waiting time from referral to first treatment is 48 days, and from referral to second treatment, when we know someone needs help, it is 159 days, Mr. Speaker. So can I ask the Minister, firstly, will she thank all the volunteers in Wirral who are trying to help those who are suffering from anxiety and depression? And will she also explain to me what she is going to do to stop this crisis now in the Wirral?
Well, firstly, I will absolutely thank all those volunteers who do so much to support people with mental ill health. And I think it's worth emphasising the role of the voluntary sector in doing that. And I would encourage NHS CCGs to look at commissioning additional services from the voluntary sector, because so much of that wraparound care is as important as clinical intervention in terms of repairing mental ill health. Now, in respect of the issue she raises, there have been problems with IAPT access and recovery targets in the past. The CCG have told me that the backlog of over 1,000 patients has been cleared after additional funding from the CCG, and that the IAPT targets are now being met. But obviously, I will keep this position under review, and I thank her for raising this issue.
Thank you, Mr. Speaker. Last year, Number 14, Mr. Speaker. Thank you.
As my right honourable friend knows and indeed welcomes, the government is committed to providing an extra $20.5 billion in real terms for funding for patient care over the next 5 years. Car parking charges are a matter for local NHS organisations. The majority of hospitals provide concessions to some groups of users, such as patients who need extended or frequent access to hospitals.
Thank you, Mr. Speaker. Last year, the brain injury charity Headway said that they paid a family £374 in hospital car parking charges. This is unacceptable. Hospital car parking charges are a stealth tax on patients, a stealth tax on the vulnerable, and a stealth tax on the staff. Will my honourable friend scrap hospital car parking charges once and for all?
Well, I commend my right honourable friend, who I know has been a tireless campaigner on this matter. We've always been clear that staff, patients and their families shouldn't have to deal with the stress of complex and unfair charges. It's why we introduced tougher guidelines in 2014. But I stress to my right honourable friend, this is a local matter.
Topical questions. Tommy Shepherd.
Number 1, Mr. Speaker.
Mr. Speaker, to provide the best care, the NHS needs the best technology, so I can tell the House that we will bring together digital leadership of the digital agenda across the NHS under a new organisation called NHSX. We're also publishing a new code of conduct for the use of artificial intelligence in the NHS. NHSX will report jointly to the NHS and to me and lead this vital agenda so that the NHS can be world leader in emerging technologies that help to cut costs and save lives.
Tommy Shepherd.
Something on your bench,
Mr. Speaker, meanwhile, in the real world, Scottish Care report that 30% of social care staff in the Highlands are nationals from other European countries. They are paid in Scotland the real living wage as a matter of public policy, which is £9 an hour, but that's way short of the government's proposed limit of £30,000 for new immigrants in the future. So can I ask him, is he going to fight within Cabinet to change this policy, or is he content to let his new immigration policies choke off the supply of labour to our social care sector?
We welcome people working in social care from the EU and from the rest of the world, and we need to make sure that that can continue, but we also need to make sure that we can train people locally to be able to work in social care, which is incredibly important.
GP surgeries across the Welsh constituency are innovating with the employment of nurse practitioners, paramedics and other types of clinician to fill vacancies when recruitment of GPs has not been possible. Whilst this often works well, we still have too many vacancies for doctors. What steps my right honourable be taking to encourage that the thousands of GPs in training consider practice in rural and coastal areas like mine in Somerset?
It makes an incredibly important point because as important as new technology is and as important as new ways of working and nurse practitioners are, we still need more GPs, and we need more GPs especially in rural and coastal areas. The Targeted Enhanced Recruitment Scheme offers a £20,000 salary supplement to attract GPs to parts of the country where there are serious shortages, and that includes in Somerset.
Neil Coyle.
Have made clear that men are being diagnosed with HIV as a direct result of the limited places on the current PrEP trial. The Secretary of State has already said this morning that the doubling of the places on that trial is being implemented now, but that commitment was made over 3 weeks ago. When will implementation be completed across all trial sites, including Burrell Street in my constituency?
I want to see this being implemented as soon as possible. It's already started, but we need commitment from local authorities as well as from the NHS in order to deliver, but I'm very happy to work with him and all other interested members to see it happen.
Sarah Wollaston.
Key parts of our NHS workforce are registered and regulated by the Health and Care Professions Council. Does the Minister share their concern about the steep rise in professional fees that they face, but in particular about the loss of the 50% discount that applied to those graduates within 2 years of qualifying? And will she look again at whether anything can be done to assist this key group of our workforce?
Minister Dinage.
Speaker, I mean, she's absolutely right, the need to support and enhance the protections for allied health professionals. One of the recent increases for the Health and Professionals Council, they were planning to raise their annual fees by £16, but it would still remain one of the lowest in any of the UK-wide health and care regulators. But it's also important to remember that regulation fees are tax deductible.
Kyle.
Speaker. The head of NHS Improvement, who's also a Tory peer, has said that the biggest problem facing the NHS is that not enough people want to work in it. Could the Secretary of State explain how did he take Britain's best-loved institution and turn it into something nobody wants to work for?
Well, thankfully, the levels of recruitment, both of nurses and of doctors, is going up, which demonstrates that people do want to work in the NHS, and so they should, because it's an amazing place to work, and it has a great mission, which is to improve the lives of everyone.
Giles Watling. Thank you, Mr. Speaker. Last September, the number of medical school places, as we've just heard, increased by a quarter, which is great news. But apart from offering premiums, how can we incentivise newly qualified GPs to come to places like Clacton, where we have an acute shortage?
So you're right, the £20,000 bonus is an important part of the solution to that, but so is having more GPs. And the fact that we have a record number of people going into GP training at the moment is a great piece of news that people on all sides of this House should welcome.
Perkins. Mr. Speaker, we know there's a huge number of GP surgeries that are struggling to recruit, and meanwhile there's lots of locums that are making a lot more money being locums than working on permanent contracts with GPs. Will he consider, with his state-backed indemnity, offering that to those who commit themselves to being on a permanent contract with a general practice surgeon?
Well, of course course, the nature of being in a GP practice is changing. For a long time, practices, which are essentially private businesses, had the benefit also of rising property prices that brought additional income on top of their income from the NHS. That obviously no longer happens because property is so expensive. So many people are changing the way that GPs are employed, so they're directly employed rather than through practices. That move is happening, but it's one of the many changes that we're seeing to try to make sure that being a GP is sustainable. And clearly, things are starting to improve because we've got a record number of people choosing to become GPs.
Thank you, Mr. Speaker. Mr. Speaker, you'll be aware of the fantastic work by the Edenbridge Memorial Hospital in the town just near me. You'll also be aware of the fantastic news that we're having a new clinic built there. Would my honourable friend agree with me that the money from the initial site, which was given by public subscription 100 years ago in memory of the young men who died in the First World War, should now be spent on medical facilities in the town?
Well, I know my honourable friend's been absolutely passionate about securing the best possible outcome for his constituents. As he knows, the Edenbridge War Memorial Hospital is held by NHS Property Services on behalf of my right honourable friend. What I'd say to the honourable gentleman and my honourable friend is this, that local NHS bodies in Kent are considering the future of services in the Seven Oaks area, including the nature and possible funding. Whilst he recognises I can't intervene directly, I'm sure he'll know that I'll be happy to meet him and discuss it further.
Thank you, Mr. Speaker. Central and East London breast screening service was performing well until last April, when it was transferred from Barts Health to Royal Free. Even though Royal Free didn't have enough staff, the number of women invited plummeted from 3,000 a month to 1,000 a month. Why was that transfer allowed to go ahead, given the very clear warnings about what the consequences would be? Who is responsible for this failure?
Well, the award of the contract for the Central and East London screening service to Royal Free was approved by both NHS England's London region and NHS England's commercial executive group. An agreed recovery plan was put in place to address the various issues. And whilst the service did plummet to 1,100 in April 2018, the service is currently inviting 3,000 women per month, which is the normal monthly invitation rate for the service for the past 3 years. Women are currently being offered appointments in line with the agreed recovery plan and the National Breast Screening Standard, with 90% or more women invited within 36 months of their previous screen by October 2019.
Paul Masterton.
Thank you, Mr. Speaker. The internet and social media has provided huge opportunities and positives for our young people, but we've been far too slow to react to the negatives, including cyberbullying and issues around body image. So could the Suicide Prevention Minister or my right honourable friend confirm that they're taking a truly cross-government approach to this issue and seriously tackle the role of tech companies?
Yes, my honourable friend is dead right to bring up this subject, because the rise in material promoting self-harm and suicide online is dangerous and it needs to be stopped. And I'm delighted that under pressure from this House, Instagram have now decided to take down this material, but there is much more to do, because in this country it is this House that makes the rules, not the global companies.
The greatest damage from prenatal exposure to alcohol is often done in the first few weeks of pregnancy, yet 3/4 of women in the recent Bristol University study say they drank alcohol while pregnant. So will the Minister commit to making sure that the Chief Medical Officer advice is given loud and clear by all health professionals? Don't drink alcohol if pregnant or trying to conceive.
I'm very pleased the honourable gentleman has raised this very important point. It's a very important public message we need to deliver, because, as he's rightly observed, the damage caused by alcohol can take place in the earliest part of pregnancy. So anyone seeking to get pregnant should be monitoring their alcohol intake and in fact, withdrawing altogether. I think it's very important we make the public aware of this, not least because of the rate of unplanned pregnancy, which continues to rise.
Royston.
Mr. Speaker, Southampton is above the English average, with nearly 6% of GP appointments missed. Nationally, this costs the NHS over £200 million a year. Would my right honourable friend agree with me that a standardised online booking system that features a reminder function with the option of cancelling or rescheduling an appointment would save money and reduce waiting times, and does he have any such plans for such a system?
Yes, I do, and this is one of the sorts of things that NHS X will drive forward. A decent IT system can reduce missed appointments in GP practices by a third. So whilst over there they snigger about using modern technology and want to go back to the past, over here we're providing the best technology for the NHS for the benefit of patients.
Louise Haigh.
Mr. Speaker, a recent answer to a parliamentary question to my honourable friend the Shadow Minister confirmed that in nearly half of cases of mental health crisis it is not NHS staff but the police that are conveying people to hospitals.
Yes.
Will the department conduct a review into the impact this is having on people in mental health crisis?
The Honourable Lady raises a very important point, and it's something that I'm taking forward with my colleague, the Minister for Policing. We're very acutely aware of the impact it's having on policing services, and that's one of the reasons why, in the forward plan, we've directed so much support and priority to making sure that NHS 111 service does work, and that we've got the community and crisis care services to back it up.
Mr. Speaker, the March 2018 report in The Lancet found that for lower back pain, most drugs and injections were useless. What is my honourable friend going to do to find alternative treatment?
Well, I want to pay tribute to my honourable friend, who has announced recently that he will be standing down at the next election. And I want to pay tribute to the amount of attention he has brought to broadening people's minds, to looking at what works and what the evidence shows works. And we know that social prescribing, for instance, can help people and can help make sure that people get the support that they need. And he has made a great contribution to this debate, and I want to pay tribute to him.
Rosie Cooper.
Thank you, Mr. Speaker. After ACAS, CAP6 and the Kirkup Review, could the Secretary of State outline how he intends to deliver justice to both staff and patients of Liverpool Community Trust, and also how he'll ensure that those board members who disgracefully refuse to give evidence to Kirkup will be made accountable and give evidence to future investigatory...
Well, I'd like to pay tribute to the Honourable Lady for her courageous campaigning on this issue. She'll know that there have been a number of reports into the events there. Like her, we understand her wish that further detail would be helpful and those in senior positions should be held accountable. I hope she will agree the Kirkup report has provided the basis for this. We're happy to meet with her to discuss how this might be advanced further.
Mr. Speaker, we want to see a pipeline of talented staff entering our NHS. And for many areas, the health service is a key local employer. Would my right honourable friend welcome proposals for a specialist school in Mansfield, run in conjunction with our hospital trust, to ensure we're equipping young people with the skills and aspirations to join our health service? And could I meet with him to discuss it further?
Well, my honourable friend will have heard the answer that my right honourable friend gave about missed appointments, and I'd be happy to meet with him to discuss it further in Mansfield. We would encourage everybody to make sure they're using the technology to make sure that cancelled appointments are notified so that it can be put for the benefit of others.
Stephen Morgan.
Mr. Speaker, mental health services need proper staffing, but there are 2,000 mental health staff leaving their post in the NHS every month. How does the government expect to achieve any ambitions in the long-term plan without adequate staff?
He's absolutely right. And when you put a very large amount of money into a service, of course we're going to need more people to deliver it. And that is most acute in mental health, which is seeing the biggest increase in funding, as 2.3 billion of the 20.5 billion overall. And I can assure him that my honourable friend, the Minister for Mental Health and for Suicide Prevention, is working night and day to make sure that we attract the people we need to deliver the services that our people deserve.
Mr. Speaker, may I ask a question in memory of my late friend Stephen Horgan, who died a few years ago from a very rare form of blood cancer with only a few months' notice. In his memory, I'm now a supporter of Bloodwise, an excellent charity that raise awareness about these rare cancers. And on their behalf, may I ask the Secretary of State, will the new workforce plan for the NHS include clinical psychologists, particularly those with cancer knowledge, in order to make the best absolute use of the very welcome resources that are going into this issue, and which I'm sure Stephen's family themselves would welcome?
Yes, well, my honourable friend puts it extremely well, because he reminds us of who we're here to serve when we are discussing questions of health and of cancer. And he's absolutely right to raise this case, and I will absolutely confirm what he asks for, we will deliver, and we'll deliver in Stephen's memory and in the memory of those others who have died, and that is what gives us the strength to carry on and try to deliver and improve these services for everybody.
Mr. Speaker, the Secretary of State talked earlier about a 6-week stockpile of medicines. One thing that can't be stockpiled is radioisotopes for cancer diagnosis and treatment. I have asked multiple times in this place about arrangements. Can the Secretary of State detail the arrangements now for radioisotopes post-Brexit?
In the event of a problem at the border, at the Dover-Calais Straits, then we will be bringing in radioisotopes by air. We've already contracted an aircraft to make sure that this happens. So that part of the planning is very well advanced.
Speaker, on Thursday I had the great pleasure to open, along with Rugby's Mayor, the new Browns Over surgery, which has come about because of the hard work of the Patients Action Group there. Will the Secretary of State welcome the work of patients groups in delivering NHS services?
I'm absolutely delighted to welcome the work of the group who have raised so much money, and of course to my old friend who stands up for rugby and makes the case. And more broadly, we should welcome all those who want to make a contribution to our hospitals, to our hospices, and take a broad-minded and open approach to welcoming, whether volunteers volunteering hours or people raising money to improve our great NHS.
Thank you.